My name's Hannah Deacon. I'm the mother of a little boy called Alfie Dingley. He has very severe epilepsy caused by a non-inherited genetic condition called PCDH19. We ran a very successful campaign in 2018 and Alfie received the first permanent cannabis licence on the 19th of June 2018, where his doctors could prescribe medication that we'd used in Holland very successfully to treat his seizures. So I now work very hard to try and give voice to people that don't have a voice, parents with very severe epileptic children who need access to medical cannabis on prescription. So that's what I do now. My son has been very, very well because of cannabis-based medicines, and I know how hard it is to live a life with a very seriously ill child, and I want to know that people in this country are helped as much as they can when they have children that are very, very ill. So, that's my mission in life at the moment. We had a very, a short campaign in the sense that my first media appearance was in February 2018 on BBC Breakfast, when I'd just gone back from Holland. We'd had 5 months of collecting evidence showing that my son massively improved on CBD with a very small amount of THC, Bedrocan products we used. I went onto the BBC Breakfast and talked about, what I wanted and the fact that I wanted my son to have an NHS prescription, and it was greeted so well by the public, but yet the government still said at that point there was no medicinal value to cannabis. So we were up against it. And actually, if you think about it, from February until June is a very short amount of time, but actually it felt like forever for us. We met the Prime Minister in March 2018 where I gave my petition in from change.org, and she accepted that Alfie needed this medicine and that we could apply for a licence for a person, which has never been done in the UK before. It's only ever been pharmaceutical companies who apply for research licences. So that was a massive step forward, and then we spent 3 to 4 months working with the Home Office creating that licensing process, which they had to go through all the legislation to do, and we agreed not to seek media attention while we did that, because we felt that work was really important, and I wanted to trust them that they were going to do the right thing for me and my child. And unfortunately, after 3 to 4 months in June, when the cannabis-based medicines hit the media again, it was clear that I felt we were being messed around. So on the 19th of June, I went on to the Today programme with John Humphreys, and I just talked honestly about how I felt about meeting the Prime Minister. She looked me in the eye and she said to me, "We'll help you, or we'll try to help you. It's going to be difficult, but we'll try to help you." And I felt at that point that I'd been played. I felt like, my son was not a pawn in a game. He was a little boy he is a little boy with very severe, incurable epilepsy, and that's not something you play a game with. And luckily, a few hours later, we were told that we would receive a permanent cannabis licence, and when the law changed, he now has an NHS prescription, and it was amazing to feel part of that. And I think it's really important to understand that as a parent, I'm part of a huge movement. I don't think this is about me and this is about my son. This is about, we ran a campaign for my child, but this is about a movement. This is about a patient-led movement. It's about lots and lots of people advocating for what's right for patients when it comes to cannabis. And, to be part of that, helping to change the law, helping to put pressure on the government is amazing. And it's, Drew and I said when we were in Holland, we never ever thought that we'd be coming home and fighting a campaign against the British government. Absolutely not. We never thought further than that day, most of the time. Alfie's first cluster, he has what's called a clustering epilepsy. So he doesn't have seizures every day, like some people with Dravet's, for example, will have seizures every day. He has a clustering epilepsy. So he can go days, weeks, months without seizures. And then when he does have a cluster of seizures, they're very, very big. They come on very, very strong, and he'll have back-to-back tonic-clonic seizures. And that's what happened to him when he was 8 months old. And we were in hospital for 4 months. And my son was being pumped full of drugs. At the time, I was desperate to stop him having seizures, so that was fine. And I completely trusted the doctors that they were doing, all they could. And they were doing all they could. And in the end, luckily, they stopped his seizures using steroids. But as he got older, he got worse. And by the time he was 5 years old, I was taking him into hospital in an ambulance, in a blue light ambulance, into A&E every week. to put it into context, we went into hospital between 2016 and 17 48 times in 1 year. So that's pretty much every week. We were woken at 3, 4 in the morning, screaming tonic-clonic seizures, which is incredibly frightening, and I was very traumatised by that. I was diagnosed with PTSD during that time because it was, it actually wasn't post, it was current trauma, and it was horrendous. I was doing that every week. Every time I took him into hospital, our doctors were saying, we have to give him steroids because it's the only thing that works. But actually we're putting him at risk of organ failure and psychosis. We don't understand the long-term impact of using steroids in a child. So at the time he was having 25 doses of intravenous steroids, and they were saying he could die from the condition, but he could also ultimately die from the products we're using to stop his seizures. And that's when, at that point, I was sinking. My child was dying in front of my eyes, and I was sinking, and I had a baby, a 2-year-old girl at the time as well, and I partner, and you're trying to survive mentally. And I think one day I just decided I either sink or swim, and I went onto the internet and started to look for natural ways of treating epilepsy. And I found William O'Shaughnessy, and I found lots of families all over the world who are using cannabis in legal countries to treat their children's epilepsy, and who are having massive reductions in seizures, massive improvements in cognition. And I just thought, why not? Why can't I use this with my son? Because actually, if I ever have to stand by his grave, as his mother, I have to know that I have done everything I can to keep him alive and keep him well. And that is what drove me. So I just decided I wasn't going to give up on him, and I was going to fight for him. And then we just started raising money. We found a doctor, and we went to Holland. And like I say, I didn't think anything further than each day, because if I thought about the future, then I wouldn't have done it, because I would have been terrified about how do we get home, what do we do when we're in Holland, all that stuff. I just thought, I've got to raise money, and I've got to see a paediatric neurologist, and I've got to try and save my son. Again, it's really important to understand, one, my son has very severe refractory epilepsy. He's one of 9 boys in the world. His neurologist has said to me he's got the worst epilepsy he's ever seen, in the sense of its refractory to products. So, he doesn't respond to pharmaceuticals at all, other than steroids. So, we're always fighting a losing battle here. And the fact that we had 11 months seizure-free is really positive, and it means he responds to cannabis. Frustratingly, because we don't have any products in the country, there's nothing else at the moment we can try. What we have done is upped his CBD, and we've also added in THCA, which has really helped him, because he doesn't tolerate bigger doses of THC. And that's the thing as well, again, talking about, to change the subject completely, is when people talk about trials. We're all different. Our endocannabinoid systems are all different. If you start a trial with 10 children with epilepsy, they'll all need different ratios, they'll all need different strains. And the problem is that at the moment, the medical establishment do not understand cannabis, and they don't understand that. And so that, that's very frustrating. But yeah, he is still doing incredibly well. He was having 400 to 500 seizures a month. He's now having maybe 5, 10 at the most. So this is about not a cure, it's about giving people who are very ill good quality of life, surely, and the families good quality of life. Yeah. And I know some people have said to me, why didn't you just go off and enjoy yourself with Alfie? And I haven't done that because I feel that the joy that I've seen in my child and my family, everyone with a child with epilepsy should have that joy. So, I've made it part of my job because I'm very, very passionate about it. I think at the moment, because everything is done on a named patient basis, the Home Office are insisting on a named patient basis, it's chicken and egg. There's no prescriptions at the moment because no one is allowed to prescribe. So companies will not make their products available to the UK, because at the end of the day, they're businesses, aren't they? So, they're not going to put a load of product into the UK that isn't going to be sold. So, and I know a lot of, again, there are people that really feel very worried about that side of things, about private industry. But again, I would go back to the fact that, there should be choice. I don't have a problem necessarily with people who want, as long, I know it's illegal, but who want to grow their own medicine. I think that we should, as a nation, look at that, because that should be people's rights. It is a plant at the end of the day, and people should have that right. But it's not appropriate for people like me, and it's not appropriate for the families I work with. what I would like to see is companies providing compassionate access, because actually lots and lots of people can't afford private prescriptions and they can't afford the cost. So, I think again it's a balance, because actually private business does bring innovation and it does bring expertise and it does bring choice, but it's about that balance, isn't it, between patient choice as well. So so it has been difficult, but I also think when you're at the beginning of something, it's always the hardest, isn't it? It will be the hardest for me and my child, because we're the beginner, we're the first people having prescriptions. And I hope in the future that it will just get better and better, that prices will come down, that people will start prescribing, and that access will be for everyone in any form that they require it. When you have a child with severe epilepsy, you haven't got time to grow cannabis. And actually, I don't want to lose the power of my children. My child, being in charge of the parental choices for my children is the most important thing for me. If I grew my own cannabis and gave it to him, it wouldn't be consistent. I don't necessarily know what's in it. I wouldn't want to get it from someone who I don't know and I don't trust, and I don't know how they made it, and I don't know what's in it, because there's lots of people out there that actually aren't very nice and that could provide products that are unsafe for children. I didn't know how to dose it. I didn't know what to give. I didn't know what ratio to do. I wanted to be under a doctor, and that's what a lot of people say with children who are ill. They want the security of someone who understands what cannabis-based medicine or products made from cannabis or oils made from cannabis, how to use them. And the problem is in the UK is actually doctors don't know how to use cannabis medicine. People like me know a lot more, and Callie know a lot more how to use cannabis. So at the end of the day, I respect people that choose that path, but it's not the path for me, and it's not the path for many thousands of people in this country who do not have the ability to do that and don't want to. And why should they? I care about being able to go to a pharmacy and getting a GMP product which is safe and consistent, and I know what's in it, and that should be the right of every patient in this country. Yeah, basically the NICE interim guidance was issued today for review from the stakeholders. That will be for the next month. In short, it basically says that randomised controlled trials are needed before we understand the long-term impacts of cannabis and the side effects, because there's not enough evidence that cannabis is safe, which I just think is absolutely ridiculous. Are we saying that every country in the world with a medical cannabis legislation is wrong? Are we that arrogant? I think that we are pharmaceuticalizing cannabis, and that is wrong. It does not lend itself to a randomised controlled trial process because of the nature of the plant. And until the exceptionality of this medicine is accepted, we're not going to move forward, I don't think. And I think that is extremely sad. I think NICE are very, very outdated. I would say openly, I applied to be on the panel. I was told that I could be if I did not do any media or talk about my feelings about cannabis. I said I hope that's afforded to all the people on the panel, and I was ignored. I know there's people on that panel that have created that guidance who have openly, in the last year, talked in the media about their concerns about cannabis medicine. So my feeling is that there is a real question to be asked about the people that actually wrote this guidance. And it's very, very concerning, and I'm very, very upset and angry about it, to be honest, because all it does is block access. And children, like the families I work with, they haven't got 10, 15, 20 years to wait for randomised controlled trials. And actually, what will happen at the end of those trials, when a pharmaceutical company makes the medicine, that medicine will still be inferior to the plant. So we're going to do all that stuff, and people will still use the plant. And actually what my greatest concern is that families who are very vulnerable with very, very sick children will turn to the black market and use products which are inferior and are not safe. So this does nothing to help people, unfortunately. It is interesting to note as well in their guidance that they say that Sativex is prescribable. Well, it's a scheduled drug and it's had trials, but it's not prescribable due to price. Sativex is a 50-50 CBD THC. So they're saying there's no evidence that THC is safe, yet they've done trials with Sativex. THC doesn't suddenly change if you put it in a different medicine. It's THC. It shows the lack of understanding of cannabis from the people that have written this evidence and this guidance, and it's just really, really upsetting and wrong as far as I'm concerned. There's a lot of people, there's thousands of people up and down this country who feel ignored and have no voice. And I see my job as someone who can go forward, give those people a voice, push for what we want, not accept, this sort of idea that we must see randomized controlled trials for the next 10 to 20 years before people get medicines made of cannabis. I mean, that's just crazy. The plant is amazing. We know it works in the entourage effect. We know how it works in that basic level. And actually splitting it all up and making it into different drugs is not going to be helpful to people. What people need is a full component of the plant. So, for children like my son, we need very, very good full extract CBD, and we need to take away this sort of obsession with THC. Some people can tolerate it, some people can't. It's like all drugs. There's a risk and benefit to everything. But actually what's very important is when you've got a child having 300 seizures a day and you give them a good CBD with a tiny bit of THC and they go down to 10 seizures a day, but there might be a slight risk of long-term use of THC. Again, we'd rather have less seizures, but yet what we're seeing from senior clinicians and the media at some points, they're focusing on the fact that we as parents want to give our kids THC. That's absolutely wrong, actually. And some children can tolerate a small amount of THC very well, some children can't. And that's the thing, it is a trial and error medicine, like actually all other anti-epileptics and all other drugs that people take for pain and opioids. They're all experimental medications. We all have to begin somewhere and see what dose we need. You're risking that with anti-epileptics all the time. Benzodiazepines are used as anti-epileptics all the time in children. No one knows the long-term impact of that. And they're lying if they say they do. And so I think that's something as well that, the plant is amazing, basically, as far as I'm concerned. That's why I advocate for it so much, because I've seen such a big change in my son. But I think we should all focus on the wonderful, power of this plant and actually try not to focus so much on the THC element, because actually it's quite a small part. But even with pain, even when you're using more THC, the CBD counteracts it. And we know that as well. So I think, we need to try and move the rhetoric away from the THC discussion and talk about actually all the other things that we need to be well. I see myself as a patient advocate. I support 20 families who we're associated with End Our Pain. End Our Pain, obviously, as a campaign group, helped my campaign. I didn't know how to speak to people in Westminster. I didn't know how to get on the media. They helped me do that, and I'm very, very grateful to them. And as working with them, I've sort of amassed a group of families that I support emotionally and strategically. And before I went to Holland, I knew no one with a child with epilepsy. I felt very, very isolated. I felt like I was the only person that felt the way I did. And actually, amassing that group of families together, we all felt like that, and now we don't, because we all know that we're all suffering. We all have the grief that our children, have seizures still or are ill, and that's very, very difficult. But it's helped when you've got people that go through the same thing. So again, it's like a support group in that sense as well. So I do that, and I'm also a director for the Medical Cannabis Clinician Society, which I do with Professor Mike Barnes, and we created that in response to the fact that there is no education for doctors. And actually, there are a lot of doctors in the NHS that want to prescribe. So how do you make that happen? And how you make that happen is change the stigma and the ignorance into education and enlightenment. So that's basically what we're trying to do. We're going to take the journey of how to prescribe, what to prescribe, who you can prescribe for, and how cannabis works and all that sort of stuff to the doctors, and hope that empowers them to start prescribing for people who need it. So, that's my sort of passion at the moment. That's what I'll carry on doing until it's better. If anyone feels passionate about what I've been talking about, please come to my social media, which is Alfie's Hope. On there, I share every day the family that I work with, before and after pictures, the case studies. These people are evidence, these children are evidence. They should not be ignored. And actually, I feel that, as I've said at the beginning, this is a patient-led movement, and if we all club together, we all push this forward and make our voices heard, then, think we will see change. So, and actually write to your MPs and tell them how you feel about cannabis, and speak to your local media, because actually, if we all keep saying that we need change, we need reform, then, MPs will listen, because they want to stay in their seats, don't they? They want to be elected. So, make your voice heard to your MPs. That's really important.